This is sample audio from this product. You will receive the complete audio to stream or download after you purchase. Thank you. This is the practice question quick quiz product for the NRCME, presented by the DSG team. That's the DOT Study Guide team. Here we go. Question number 1. Is Meniere's disease disqualifying? Yes. Number 2. Can a patient who takes Bentyl for IBS be cleared? Yes, as long as the medication adequately controls symptoms. 3. What is the maximum time for certification in well-controlled nephropathy? 2 years. 4. How many years must a driver with a single unprovoked seizure be seizure-free and off anticonvulsants before he can be cleared? 5 years. 5. What is the maximum certification period for a single unprovoked seizure after the waiting period? 2 years. 6. Can a 3-month certificate be issued consecutively for a blood pressure greater than 140/90? No. 7. How soon can a driver be certified after CABG? 3 months with cardiology clearance, resting echo with EF greater than 40% post-CABG, and asymptomatic without angina. 8. Can a driver with a history of narcolepsy ever be cleared? No, because of the likelihood of excessive daytime somnolence. 9. Can a driver be certified with a diagnosis of diabetic peripheral neuropathy? No. 10. Who is responsible for ensuring that the driver has a current medical examiner certificate and diabetes exemption before allowing an insulin-dependent driver to operate a commercial motor vehicle? The motor carrier. 11. What is the recommended certification for a driver with diabetes mellitus who does not use insulin? 1 year. 12. What 3 pieces of information should be included in the written statement from the healthcare provider prescribing an incretin mimetic to drivers, or to a driver? The driver's tolerance to the medication, the driver's frequency of monitoring their blood glucose, and the efficacy of treatment. 13. How long does an exemption last? Up to 2 years, but may be renewed. 14. Which 2 specialists must be involved in the process of a driver obtaining a diabetes exemption? Endocrinologist and ophthalmologist with annual evaluations by each. 15. Can a driver with diabetes mellitus who uses insulin be certified? Yes, but only after they obtain a federal diabetes exemption. 16. Can a chiropractor perform and certify vision test results? Yes. 17. A driver with a blood pressure less than 140/90 who is previously disqualified with stage 3 hypertension may be recertified for how long? 6 months if medications are well tolerated. 18. What defines a severe hypoglycemic reaction? Need of assistance from another person, or loss of consciousness, or any period of impaired cognitive function that occurs without warning, or a seizure. 19. What is the most common cause of retinopathy? Diabetes mellitus. 20. What does the FMCSA medical examination report include? Both a health questionnaire and physical examination. 21. What is the next test to consider if urinalysis reveals glycosuria, or glucose in the urine? Finger stick glucose. 22. How often must the federal diabetes exemption be renewed? Every 2 years. 23. What range of blood glucose levels is generally considered safe for commercial driving? 100 to 400 milligrams per deciliter. 24. If the FEV is less than 65%, what should the PaO2 be in order for a driver to be certified? The PaO2 should be greater than 65%. 25. How often should a driver with mild aortic regurgitation have an echo? Every 2 to 3 years. 26. What is the minimal requirement for CPAP use? At least 4 hours per night for 70% of nights. 27. When does an SPE certificate have to be renewed? 30 days prior to expiration date, and renewal cannot exceed 2 years of the date of issue. 28. How often should a driver with a fixed deficit of an extremity have a physical exam? Every 2 years. 29. What is the maximum certification for a driver with a history of pneumothorax who is stable and asymptomatic? 2 years. Number 30. What is the waiting period after PCI? 1 week. 31. Who is responsible for determining if the driver meets the program requirement and for issuing the diabetes exemption? The Federal Diabetes Exemption Program. 32. What specific test is required to assess grip strength or grip power? There is no specific test required by the FMCSA. 33. What does medical fitness for duty include? This is the ability to perform specific tasks related to driving the vehicle and strenuous labor. 34. Who is responsible to determine certification status? The medical examiner. 35. Who is responsible for ensuring that both certificates are renewed prior to expiration? The driver. 36. Can a driver using hearing aids, can they use them for the forced whisper test? Yes. 37. Why would a driver be taking levodopa-carbidopa? Treatment of Parkinson's disease. 38. Can a driver with multiple sclerosis obtain an SPE certificate? No, because multiple sclerosis is a progressive disease process, not a fixed deficit. The SPE is only for fixed deficits, such as a missing limb. 39. What is the waiting period for a driver with TIA? 1 year seizure-free and off anticoagulants. 40. What is the waiting period for a driver with BPPV taking meclizine? 2 months symptom-free and off of the medication. 41. You must review and discuss with the driver any yes answers to include any illness or injury in the last how many years? 5 years. 42. What is the waiting period after ENT surgery for OSA or obstructive sleep apnea? 1 month. 43. Can a driver be certified with a diagnosis of myasthenia gravis? No. 44. Is all anticonvulsant medication use disqualifying? No. If used for chronic pain or psychiatric disorders, these may be allowable as long as they do not interfere with safe operation of a CMV. 45. What is required for a driver with congestive heart failure to be certified? For more information about the other products we provide regarding the DOT exam, meaning the NRCME, please go to our website and purchase our products there. Thank you for your support. Your purchase of this and our other audio and visual products allows us to keep producing and improving the content we provide.